Hello, everyone. My name is Virginia Tesser. I am the External Affairs Manager at the New Jersey Healthcare Quality Institute. The Quality Institute is a nonprofit, nonpartisan membership organization working to improve the safety and quality and affordability of healthcare for everyone. We have brought together today William DeStanislao, Vice President of Operations at Raritan Bay Medical Center, and the Mayor of Perth Amboy, Helman Kaba, to discuss how they successfully work together to achieve better health results for their community. Hackensack Meridian Health has been a longstanding member of the Quality Institute and supporter of the Quality Institute's Mayor's Wellness Campaign. The Mayor's Wellness Campaign is our statewide community health initiative that provides evidence-based tools and strategies for mayors and community leaders to help their residents achieve healthier lifestyles and to improve overall health and wellness in their communities. Perth Amboy has been a part of our Mayor's Wellness Campaign since 2009. This meeting will be recorded and a copy will be available on our website. William, thank you for being here. Please tell us a little bit about Hackensack Meridian Health.
Thank you, Virginia. So Hackensack Meridian Health is one of the largest healthcare systems in New Jersey. Specifically, Raritan Bay Medical Center and Old Bridge Medical Center, part of HMH, have a combined bed license of about 500 beds. We offer state-of-the-art facilities for cardiac cath, surgery, OBGYN, and the like. We're proud to say we just recently received an A in Leapfrog. And so being that this is a quality supported meeting, I want to share that first for Old Bridge and for the Amboy at the same time. And so we're extremely focused on quality. I think Raritan Bay Medical Center, what we're talking about today in the town of Perth Amboy, is very fortunate to have a support of the local community. I would say 85 to 88% of our team members live within 5 miles of the hospital. So it truly is a community hospital, and the care that we deliver is largely supported by Perth Amboy, our main primary service area, and a few other towns surrounding Perth Amboy, but Perth Amboy being the focus on keeping the community healthy and safe.
Wonderful, thank you, and congratulations on that Leapfrog score. We are so happy to hear that. Mayor Kaba, thank you for your time. Please tell us a little bit about Perth Amboy and also introduce your colleague who is joining us.
Sure. Thank you, Virginia. And Perth Amboy right now is the #1 city as far as population goes in the entire county of Middlesex. With our census, our population is at 55,400, which we were #2 behind New Brunswick. Now we're #1, and what that tells us is that we have a lot more people to care for, right? As the population continues to grow, and that's why we try to do our best to provide the best health initiative for our residents. I have here Diane Roman. She's the new Director of Human Services. She's been employed with the city for many years in different capacity. But Diane is a great asset to the city of Perth Amboy.
Thank you, and I know in preparing for this call how much of a treasure Diane is, so can't wait for everyone to meet her also. So this past year, the Mayor's Wellness Campaign saw examples of towns working with organizations throughout their communities to provide needed services, such as transportation to medical appointments, hosting exercise classes, collecting data on important issues like mental health and substance use, offering education about advanced care planning, distributing healthy foods, and opening COVID testing sites and vaccine clinics. We want to share how one of our Mayor's Wellness Campaign sponsors, Hackensack Meridian Health, worked with Perth Amboy during COVID. So William and Mayor Kaba, can you please share more about what led to this successful partnership during your vaccinations? Mayor Kaba, why don't you go first?
Sure. And I want to thank William for all he does at Hackensack Meridian. And I want to thank Hackensack Meridian in general, because They are a great partner to the city of Perth Amboy. We are blessed to have a hospital right here in our beautiful city. It's greatly needed. And I love all the investments they're doing as well. So
Thank
when
you.
I took office in January of 2021, we were posed with, just like many municipalities, with the challenge of the pandemic. And Perth Amboy was the highest or had the highest infection rate in the entire county as far as COVID. And we were the lowest in vaccination rates. We were around 30%, between 30 to 33%. So I knew that we had a great challenge ahead of us. So I put together a COVID-19 recovery task force, and it consisted of key local, county, and state leaders, and Hackensack Meridian is one of them. And we made sure that we partnered together to provide all the different skill sets to give or turn the tide, right, as far as the vaccination rates in the city of Perth Amboy, and to make sure that we are addressing the concerns that we were posed with. And I could tell you we were very successful, because within half a year, we went from 33% or so to almost 90% vaccination rate. And I can't credit one individual or one entity, because it was truly a partnership that we still have. And now our greatest challenge now is in regards to the boosters. And we are still doing some of the things that we were doing last year, and we're going to be doing a lot more. Virginia, you mentioned the mayor's wellness campaign. I want to make sure we're kicking off a lot more events. And William, if you want to expand on the COVID-19 task force partnership that we had.
I think for me, thank you, Mayor, for your kind words. Always a passion in my career was to try to do something greater or make a bigger difference. And I don't think any of us would have thought sitting here today that this would have been one of those success stories where we truly improve the well-being of the community. The partnership, as Mayor Kaba mentioned, has grown to greater heights than I think any of us would imagine. And I think it really is a template for hospital administration and mayors across all states to have, because that communication, that open dialogue with Donna and her team and the mayor, whatever the issue may be, we all know communication is critical. And I think once you establish that foundation, you can do great things. And so one of the great things we did was partnering with them. I had two as Mayor Coppa mentioned, it's not one person, it's a whole community. And so I had several leaders, an infection control manager, Jane Badaracco and Scott Skrvanek, my EMS emergency preparedness leader, really passionately partner with the town and do whatever we could to support this initiative. And so, as Mayor mentioned, we've done a lot of different things with them, and these different events, whether it's a backpack back to school night, night out, national night out, I think all these events, the hospital team rallied around those events to try to successfully vaccinate. And as the mayor said, we did over 90% of this community, with a very diverse community, very diverse population within the hospital, which we are very proud of. And I think that alignment helped us communicate largely and get out the word to do this successfully.
Mm-hmm.
Yeah,
right.
And I agree with both of you that just having those communal gatherings are just great touch points to your community, and having that communication already going. When there's a crisis, it's just that much more effective. So thank you for that. We hope that promoting partnerships like this will encourage other mayor wellness campaign towns to work with local partners and create new connections. So for towns or organizations interested in strengthening their outreaches and resources to achieve better health outcomes, is there any advice you can offer? William, why don't you go first?
I think just get involved, right? Set up a meeting with the mayor, the town council, get involved, get your executive team involved and engaged, because life is all about relationships, and work and play are no different. And I think having those relationships that will continue, as Mayor said, we're embarking now on a tremendous behavioral health expansion for Middlesex and beyond. And it really involves partnering with all of the towns, all the local community groups, all of the churches, et cetera, because as you know, through the pandemic, behavioral health, mental health has been a growing need to provide that service. And so now we're moving on to continuing those vaccinations and those events, but now we're talking bigger. How do we provide more mental health, more education to the communities we serve, and get out to the people that really need it most? And I think, my one word of advice is you have to work at it. You have to make it a conscious effort to reach out to your officials. We have great relationships with the police, the fire. Many of my leaders are retired from the fire department, police force. So it's an honor to work here in this organization in HMH, who was really promoting the vaccinations throughout the state of New Jersey, and one of the biggest contributors to vaccinations here. But to work with these leaders who grew up in these communities and who know the town and know the community and are part of the families that Mayor and Donna take care of. So I think just get involved.
Agreed. And Mayor Cava or Diane, if you would like to add anything?
I definitely agree with William. Collaboration is the key. Being involved is the key. We collaborated with over 40 partners or partnerships in the city of Perth, Amboy. We collaborated with the houses of worship. We collaborated with different businesses throughout the city, pharmacies, schools, and community nonprofits. And Diane led those initiatives and a lot of the events. Diane was a big part of that. And collaboration is still the key to this day. And it continues to grow, that partnership that we have with the community.
Virginia.
Sure, go ahead, Diane.
Thank you, Virginia, and thank you, Mayor and William, for just allowing me to share some of the success that the city has had. And I want to echo the words of the mayor and, of course, William as well, because, from the onset, once that mayor took office, healthcare was at the top of priority and really working out a plan that would be fruitful for long term. And so developing a task force with myself and our Perth Amboy Chief of Police, Larry Catano, who also serves as the coordinator of the Office of Emergency Management, we really targeted the top ranking officials of agencies throughout the city, as well as the county level. We included, personnel from the county and the state level Department of Health to really be able to provide the city with that support. We really laid out a plan. We went block by block, census tract by census tract, really engaging the businesses and really having a more coordinated strategy. So if in our south part of the city, there was an event taking place, let's say by one of our local nonprofits, how can Hackensack, Meridian, and some of our other local providers, medical providers, can come in, step and support that entity to be able to have vaccination. In addition to that, we really work with our largest employers, our Board of Education. We work with the hospitals team. We work with local businesses, let's say the Target company, who has a large, number of team members. We work to try to coordinate some vaccinations at their sites. or work with the county in our train stations several Saturdays to really target, the transit community that will travel over the weekend to, go. We had several, thanks to the Middlesex County Health Department and their Board of Commissioners, who made sure that we were supported, and the hospital will then bring on, thanks to Jane and Scott, they were amazing. Every time that we reached out to the hospital staff, they were like, okay, how can we support? Really, really made it an easy transition. So when a church or a local business, or we work very closely also with our local downtown business community. So if there were events that they were hosting, we try to work with our bid to make sure that they knew that they have the ability to also host, events of their own, targeting their own, because everybody that wanted to, we wanted just to do it in a coordinated basis. And really that's how we've been able to achieve success. But to the mayor's point, our challenge and our continued campaign is our boosters. So in all of the events that we're currently having, we've been, having boosters available through some local pharmacies, working with the county and the local health department as well. And we still, are on task for having that available as we move forward through the end of the summer and in the fall as well.
And I want to say to Diane's point, it was a blessing, when we had clap outs, when they were organized with 11 different municipalities, giving that extra boost of morale to our team members. I mean, it still gives me goosebumps to think about all the things that the town did to support our healthcare heroes. We wouldn't have been able to make it through this pandemic without the community support, whether it was donations, a simple thank you, banners, clap outs. I mean, the list is just endless. And I think that's one of the positive things that have come out of this unfortunate, COVID experience, is those relationships that can continue through the future and do more great things, as we're both not-for-profits to take care of the communities that we're so passionately we want to serve.
Great. Yeah. And you're kind of leading me into my next question, which we know that one of the silver linings during COVID were these new partnerships and collaborations. Are there any lessons learned during this collaborative effort that you will continue? William, if you want to go first.
Like I said, I think having the mayor and Diane on speed dial, no matter what issue it would be, whether there's an incident in the community, in the town, that we can support, or event we can support, I think it's crucial to help them achieve their goals and us to achieve ours as well. I think the other thing is I am immensely impressed on the number of community activities that the town sponsors for its members. And I receive that email and I share that with all my staff every day. So whether it's a special bike event, a historical event in town, the fireworks, all of our 1,200 team members know about it, can be further engaged in the community that they live in, which maybe they weren't getting that communication. So it's that collaboration that is essential, continue to move forward.
That's wonderful. And Mayor Cabo or Diane?
What I would add is the educational piece to all this, right? Providing educational materials to the residents about vaccinations and the myth versus facts, because that's one thing that to this day, there's a lot of myth out there, and the more facts we provide, the better results we're going to receive. And that's where we saw a difference when we were meeting with the houses of worship and providing them with actual facts about vaccinations. That's when we saw a turnaround in that segment of the population. And we need to continue doing that. We need to continue educating the public in regards to the boosters and vaccination and the entire COVID-19 virus, right? Which we keep getting different information from the CDC. So we need to make sure we're always providing them the latest facts And, I could tell you, I know it's been a challenge for everyone globally, right? Because in the beginning, no one really knew what we were going against. This COVID-19 virus was really new to everyone. So this is something that's going to continue to evolve as we learn even more about not only the virus, but also the mutations of the virus. Education is, and providing that educational materials to the public, I believe is key to combating this COVID-19 virus.
Yeah, no, agreed. Education is key. And it reminds me of a sign I have in my office that says, don't tell someone what to do, explain why you are asking them to do something. So, and then Diane, I saw you wanted to jump in.
Yes, just to add to the mayor's point, the task force really was created for COVID, but we've collected, and I know the mayor was really adamant about saying, we should not limit ourselves just to a task force that addresses health and wellness issues in our community, because having a healthy community is important for the administration. And so to that point, we will continue to meet with the task force, maybe just change the COVID, because we want to make it a positive thing. So when there's things coming down the line, that we are still connected with all of our healthcare professionals that can guide the city as to what are the current trends. How can the city be more proactive in supporting our residents who may have either a language barrier, understanding, or really, to the mayor's point, combating myths that, especially with the booster, but moving forward, our goal is to continue to have a continuation of meetings with our COVID task force members, and really addressing other healthcare issues in the city together with HMH.
That's great. Thank you. And I love that William said you guys are on speed dial. So I know the relationship is good, but I know how strong it is now from this COVID pandemic.
Especially in this ever-changing world we're in, right? Workplace violence. I think having, the speed dial of Larry, the chief of police, also to help us do active shooter drills to try to make the hospital more secure and safe for its team members, patients, physicians in the community. I think that partnership exceeds the four walls of both of our towns. And every day, he's coming up with new ideas to make the surrounding, the traffic flow, or the interior of the hospital safer for the community and for all of us. So I have to commend the support from the town under Mayor Cava's leadership has really it helped us get better.
Thank you, William. And, this whole COVID-19, when people think about the COVID-19 virus, they only think about that, but they don't think about the side effects. And the side effects, one of the biggest challenges that we're seeing is mental illness. And that's where Hackensack Meridian is truly a huge partner in this. And they're making a great investment into their facility to make sure they're able to provide the help that our city needs. But mental illness, as we see worldwide, is on the rise, and a lot of it is due to the side effects of this COVID-19 pandemic.
Agreed. We definitely have our work cut out for us. There's a lot of people who need assistance in the mental health space for sure. So I just want to say thank you again for everything that you've done, and I know you will be doing. Thank you to Hackensack Meridian Health and to Perth Amboy's Mayor's Wellness Campaign Committee. Your efforts really are truly helping to improve Perth Amboy residents' overall health and wellness. So thank you again for your time, and enjoy the rest of the week.
Thank you, Virginia, for this opportunity.
You too.
Thank you.
Thank you, Diane. Thank you, Mayor.
Bye, everyone.